Hi, I'm Phil.
Hi, I'm Bindy.
So today we're going to talk about when you need to give foot pain the boot. So
And this is the kind of boot we're talking about. It's an air cast boot.
so a boot like this, you'll often see people get them after they've had surgery or a fracture of their ankle, that sort of thing. But as podiatrists, we often use a boot like this to heal certain conditions. So I guess if we talk, maybe let's talk a little bit about the boot and how it works, Bindy. So what are the main things that we find that what are the elements of the design of a boot like this?
So it's very rigid and well structured. So what it does is keep the foot in a fixed position, keeps it immobile and stable so that there's minimal movement.
Yeah. There's a thing that you may notice, if we hold it like this, you can see the bottom of the sole is actually in what we call a rocker profile. So the shoe, instead of making the bones in your foot move, particularly in through the rear foot here, see if I can get some of these layers. Yeah, so in through the ankle and the midfoot, instead of those bones actually having to move, the boot basically holds them and then it just goes along for the ride. And we find that's, I know with you, Bindy, and myself, whenever we have a patient who's in a lot of pain, we can often use a boot like this for a number of weeks to settle down their symptoms.
Yeah. And inside there's also a little bit of padding where we can, if we need to tweak anything, add any raises and things like that, then it works really well for that too. Yeah, so we can do a little bit of orthotic
customization. When it comes to using a post-operative or a cam walker boot like this, they range in price, starting around $50 up towards the sort of braces that we keep in stock, which are around that $200 price range. Well, I know that in my career, and the rest of our podiatrists would agree, the better the quality of the boot, the better the job it's going to do. So it's going to stabilise and do a better job. So this is not a time to try and save money, spend a bit less. If you really wanted to get the results, a good quality boot like that. And the really interesting thing about this one, this is actually an air cast, and it's got these pumps. I don't know, I was a kid in the early 90s and we had the Reeboks, Reebok pumps, So it's basically like that. So you got this pump here, and as you pump it up on each side, it actually fills the air bladders in here to actually help to make it more comfortable. Because
usually people that have to be put in these have swelling anyway, and as that swelling settles down, you find that you need to inflate it just to sort of stabilize and make the boot fit much more securely.
Totally controls that edema. So conditions that we would use a boot like this for. So I mentioned before things like fractures and surgical. So most of our orthopedic surgeons and physiotherapy colleagues would see patients at that stage. We as podiatrists, we tend to see people once things have been going on for quite a long time, so more in that chronic phase of injury. And there's just so many conditions that we'd use it for. What's an example of some that you've used one for recently?
Achilles tendonitis, and heel pain, severe plantar fasciitis, where there's inflammation all around here, the heel at the back, all along here. So it's just absolutely paramount to immobilize the foot. And there's so much swelling in the area, you can just, your body's telling you it doesn't like it, you need to stop using it.
Yeah, that's right. And it's certainly not a long-term strategy, but it is a way of getting people's pain level from, people who are 8, 9, 10 out of 10. With a boot, we can then control that motion, reduce the tissue stress, and get people down to a stage where then we can transition into other treatment options like orthotics or hands-on therapies or whatever. Another condition that I often see, Bindy, when I've used it quite a bit, is for people who've got a severe flat foot deformity. So in the arch here, in the medial arch of the foot, if that starts to collapse over time and then all of a sudden starts to really collapse over, often we'll have issues with tendons like this guy here, the tibialis posterior. So that's for people who've got that pain on the inside of the ankle, and that can become debilitating. And without controlling that foot and really giving it putting the brakes on, that tendon can stretch and sometimes even snap, and then we end up in a really bad way. So that's another example. Now you may, if you're watching this video you may not know what your injury is, unless of course you've seen a surgeon or a doctor or a physiotherapist or someone else who's given you a diagnosis. But regardless of that, if you have foot pain and if you've tried various things without much success, really it's just a matter of calling our clinic and coming in, because not only do we have the treatments to fix foot pain, but we actually have the experience. We will know what's wrong, basically, so we can diagnose what's wrong and then develop a treatment plan. So whether or not you end up with a boot like this or not, any foot pain,
and it's better to be assessed to see if you actually need that or not. Like, we'll give you the right kind of boot.
So it's not something you come to our clinic and purchase it at the front desk. We'd always use it as part of a comprehensive treatment plan. So yes, now you know when to use a boot for foot pain. Thank you for watching, and if you have any questions, you can comment on the video or really call our clinic, because we're here open in our clinic 7 days a week. No, that's not right. 5 days a week. Don't call on the weekend because we are busy. Okay, thank you for watching.
Bye.
Bye.